Hi everyone, how are you? It is Dr. Emily, podiatrist and human movement specialist, doing a video based off of the request of actually quite a few people who knew that I had COVID and then was experiencing some post-COVID symptoms, including brain fog, dysautonomia, where my autonomic nervous system was kind of stuck in fight or flight, and then some gut issues as well. If you are not familiar with my experience with COVID, I'll just briefly mention the dates as far as I had it and not really focus so much on that aspect of the video, but more so the post-COVID symptoms and what I did. And I guess what others are looking for, that encouragement of how I got past those post-COVID symptoms. So I was diagnosed with COVID in March 23rd to be exact. And this was when I lived in New York City, the height of COVID when it was there. And I most likely got it from one of my patients. Had kind of the standard experience of COVID, meaning some GI symptoms, fatigue, standard difficulty breathing, but I was never admitted. I did call the emergency room or 911 one night when I had very difficulty breathing. But my O2 sat was not low enough to go to the hospital. And then I just kind of rode it out for the last couple weeks. It was definitely probably a total of 6 weeks of waxing and waning, thinking that I was great. And then suddenly I would have difficulty breathing, or suddenly I would get hit with some GI symptoms again. So roughly around 6 weeks. Now, after that, I then was experiencing some severe post-COVID brain fog. Now, brain fog, if you're not familiar with brain fog, to me, it is like trying to think in a room of cotton balls, which I don't know if that makes sense. Or if you take cold medication and you get that very disconnected feeling. You had an awesome night of partying and it's the next day and you're just like, well, like totally hungover and mentally just like fuzzy, but you don't get the joy of the party before. That was literally every single day since experiencing COVID until about, I'd say a month ago. So I had a good 7 months of brain fog and brain/gut symptoms from COVID. And I definitely had thoughts that I was never going to feel like myself again. The first couple months I tried to just do it myself, took some anti-inflammatories, the omegas, things that I could try to control inflammation within my body, anything that could cross the blood-brain barrier to then help myself. And it really was after several months of that I was desperate. And honestly, I was not very productive from a work perspective. And the side of brain fog and post-COVID symptoms that I do want to emphasize is the dysautonomia or the autonomic dysfunction. So my vagus nerve and my autonomic nervous system post-COVID was pretty much stuck in fight or flight. So that was very hard on my marriage. I had a fuse about that big, and then I would just flip on everyone because I was just stuck in this constant state of fight or flight. After several months of that, like I said, I sought out a functional medicine doctor. I actually saw Dr. Gabrielle Lyons, who is incredible. I do recommend checking her out. But what I want to have as the emphasis of this video is what I found out by going to a functional medicine doctor, the protocol that she put me on, and then just a little bit about what I did from a day-to-day perspective. So what my day/week looked like so that others can consider what I did and see if it could help them as well. Now, the point of the video is to not go into theories of post-COVID brain fog or post-COVID symptoms or people who think that COVID doesn't exist. So just any of that, I encourage people to just not type in comments about that, please, because whatever the cause is, even if I had brain fog from a candida infection in my gut, you still have to respect what other people are going through. And honestly, the hell. I literally felt like I was in hell for almost 8 months. So we just want to be respectful of what everyone is going through. Okay. So now seeing a functional medicine doctor, why I think that this is important is that we don't know the true cause of the post-COVID brain fog. Now, is it an inflammatory response? Sure, we know that, right? If you start to get a leaky gut or you get a dysbiosis in your gut, partly because of the gut impact of COVID, does that have an effect on your blood-brain barrier? And then you can get microbes and inflammation and different particles that can enter the brain? Sure, 100%. So we're all on the same page with that. But what I would say is that are the symptoms that you are experiencing or someone you love is experiencing, is it purely COVID? Or is it perhaps that there were all of these issues that were kind of riding under the radar and COVID was the diagnosis or the trigger that was the straw that broke the camel's back, in a sense, which is really what I think it was in my case, that I had some low-grade things happening and it really didn't come to face, or maybe I started to accept some of those symptoms that I was experiencing based off of that lower grade dysfunction or imbalances in my body that I started to kind of calibrate as normal. And then having COVID just skyrocketed it, and it just put me to the point that I could not function off of that. So that's really what I think was the case. And that's why I do think that it's important to see someone if you can. And I encourage a functional medicine doctor versus a standard Western medicine, because they probably are not factoring this in and looking at this the right way or holistically. So in the beginning of July, I saw Dr. Gabrielle Lyons, who's a functional medicine doctor, and she tested for literally everything. She took 18 vials of blood. We did a fecal test. We did a urine test. And she was really looking at several factors or areas. Is hormones. So what was going on from a hormone level? Because when your hormones get thrown off, sometimes you can get brain fog symptoms. Also from a gut perspective, what does my gut biome look like? Are there markers of leaky gut that might be happening? And then from a inflammatory perspective, of course, measuring different inflammatory markers, TNF alpha, CRP, ESR, interleukin 6, any of those markers that we may be looking for. And then the fourth one is, are there any toxicities? Meaning, do you happen to have Lyme disease and you don't realize it? Do you have mold toxicity or any other toxins that may be have been under the radar, and now you just had this heightened experience from it? So that's what we were essentially looking for. Now, the results of my testing showed that I had lower levels of progesterone, and lower levels of progesterone can cause a autonomic dysregulation. So your epinephrine or your adrenaline can actually be a little bit dysregulated when your progesterone is thrown off. This can then keep someone in more of a fight or flight state. And then there are, of course, other effects of the sympathetic system, which can include the heart rate and your oxygenation when you go from a lying position to standing. If you've ever heard of orthostatic hypotension, that's where someone goes from lying down to standing up, and they don't have enough pressure or resistance to keep the blood and the oxygen to the brain, and then they start to get lightheaded. I was actually experiencing a few things like that, and some of that can be from again, dysregulation of the autonomic nervous system. I also, from a gut perspective, my gut was pretty much sterile, which is what I could have told you, just because I had massive GI symptoms from COVID. I had primarily diarrhea. I probably had diarrhea for good 6 weeks. And because I was also on high doses of vitamin C, as far as the COVID prophylaxis and COVID treatment, is high levels of vitamin C can cause diarrhea. And before that, I was also taking a lot of magnesium, and magnesium can cause diarrhea. So all of these things combined really just created some sterility in my gut. What was also interesting is that there is a marker for leaky gut that showed as quite high. And I can't remember what that marker is right now, but it is something that can be done through a fecal and blood test. Is there's a marker for leaky gut, which is essentially telling you that you theoretically have leaky brain or the blood-brain barrier. So that was an area that we definitely had to get under order. And then I also had very high H. pylori, so a high gut bacteria that you do not want. Inflammation was not as high as what they had suspected. So my ESR and CRP were not sitting really high. Doesn't mean that I did not have gut inflammation or brain inflammation, but it just wasn't the thing that was kind of going after it. And then the other part that was really interesting is the toxicity. So I actually had some very high pesticides that were in my body. Actually, the pesticides were not even on the charts. The chart was, imagine if it was like 0 to 10 and it was not even on the marker. It was over here. So very high pesticides, some high plastic and gasoline byproducts. And this is when I lived in New York City for 20 years. And the last 5 years, I was living right off of the West Side Highway, and our apartment windows faced the highway. So it's quite possibly that just living in an urban city for so long and then being right off of that West Side Highway. But I had very high levels of 2 different gasoline byproducts that were in my system. And then finally, I did have mold toxicity. And there is a lot that you can read about mold toxicity and what it does to cognition and brain fog, dysautonomia. Oftentimes it can mirror or mimic Lyme disease. And a lot of people with Lyme disease also have a concomitant mold toxicity. And so that's really what I was dealing with, right? So those were all of the blood levels, fecal levels, urine tests. And then my primary experience was brain fog, fuzziness, fatigue, lack of concentration, lack of creativity, and really being stuck in fight or flight. My nervous system would actually buzz. And I remember we had just moved to Arizona July 1st, and I was sitting in the kitchen with my husband, and I would feel like my nerves in my arm were vibrating. For anyone who has ever had restless leg syndrome, I had restless leg syndrome when I was pregnant, like the last half of my 3rd trimester, I had restless leg syndrome, which is awful. And I started getting restless leg syndrome again as part of this symptom. And then I started getting what I would just call restless arm syndrome. And it was just like bugs crawling through my arms. Awful experience. All right. So now, the way that we approached this was that we have to focus on the brain, focus on the gut, and then focus on the liver, because that's your detox system. And again, this is just my experience, but this is why I think that it's great to work with a functional medicine doctor so that you can find out really what was maybe riding under the radar, and then COVID just threw it kind of up to the ceiling, and now that's what you're experiencing. Okay. So my routine, and again, my routine, not everyone's routine, but this is the way that we approached it from a functional perspective, is in the morning, I would start my day with binders. So I was taking specifically cholestyramine, which is a prescription strength binder. Other binders are chlorella and charcoal, and I had really good results with those binders. If I happened to have a glass of wine with a friend or my husband, I would definitely take the charcoal at the same time, just because I knew that my body was so stressed. But as soon as I got onto cholestyramine, this prescription strength binder, which can obviously bind you up, so you have to be very careful with it, I noticed great response. I was taking some nootropics. I was taking Noopept and citicoline, or another one similar to citicoline is alpha GPC. So these are choline-based supplements to just kind of try to be as functional as I could during this chaotic brain fog period. Dr. Lyons did put me on modafinil, if you've heard of that, but I didn't really sit well with it. It kind of made me like tweaky. And I didn't like that. I didn't want to get irritated on something. Another thing that I was on are phospholipids. So there's a supplement called Body Bio, which are phospholipids. So it has phosphatidylcholine, phosphatidylenostyl, and a couple other ones. But these are really good. So the fat for the brain, the phospholipids for the brain. And then, of course, I was taking glutathione. So you're thinking liver, glutathione, milk thistle for the liver as well. And then for the mole toxicity is I was taking synapsin, which is a prescription, and it is methylcobalamin or vitamin B12 and another ingredient that you take nasally, and it is something great because in the nasal passage you get access to the brain very well. So that was something that was really important for me. That's a prescription, so you would want to speak to your doctor about that. That was my morning. That's how I started every morning. Of course, I took these things several times throughout the day. And then when I ate, this is when I, of course, focused on the gut, is I was taking enzymes, probiotics, manuka honey, which is great for the gut biome, and then aloe, which is just to kind of offset any of the effects of the cholestyramine to make sure that I was staying regular. At night, to help me go to bed, is I was using a topical CBD by Prose, P-R-O-Z-E, Prose. It's called Nerve, and I was using that for the restless leg syndrome, obviously an oral CBD as well. And then I took GABA, Skull Cap, which is a herb supplement that actually increases VEGF, which is, think of it like growth factor, vascular growth factor for the brain. And that's something that, of the research that's starting to come out with post-COVID brain fog, is they've seen that individuals with the brain fog or post-COVID brain symptoms actually had decrease in VEGF. Other ways to increase VEGF is exercise, cardio exercise, but a way would then be with Skull Cap as a supplement. So I was taking that, and then oral progesterone. So that was my regimen. That's still my regimen. I've been taking this now for 4 months consistently. And I told myself that I'm going to not pass any judgment. I'm going to be super compliant for 3 months, knowing that is probably going to take 3 to 6 months for me to feel any effects on this, like positive effects. And I'm not going to pass any judgment. I'm not going to get impatient. I'm going to believe in this system and give it a good 3 months before I communicate anything or I judge anything. I've been doing it now 4 months consistently, and it's interesting that at the 3-month mark, it was like, oh my gosh, I woke up and I was like, I don't even want to say this out loud because I feel like it's going to jinx it. But for the past month, I've been feeling 95% better, which is amazing. But after that 3 months, for the first several days and then the week of feeling like back to myself again, I, again, just didn't want to communicate it because I was like, oh my God, tomorrow it might come back. Oh wait, okay, now it's been a week. Okay, but what if tomorrow it comes back, right? So it's really interesting of how these things work and how you, I don't know, just you appreciate normalcy, like of how you feel. So for those that are listening who might be experiencing post-COVID brain fog, please do stick with it and stay committed, and I believe that you will get better. That's what Dr. Lyons told me. She was like, you will get better. And I was like, I don't know. Like, this is 6 months of this now, and I don't feel like myself, and it's awful. I have a baby and my marriage is on thin strings because I'm so dysregulated, but I'm so glad that I went to see her. Some other things that I did, just kind of bonus stuff, because remember, I did have toxicity. So a lot of what I was experiencing got heightened because I had this underlying toxicity, or you could even say you just had toxicity. You didn't even have post-COVID brain fog. Remember, the straw that broke the camel's back was COVID. So we all want to be thinking of what do we have that's underlying. Okay, so what I did was infrared saunas. So I did 40-minute infrared sauna 3 times a week consistently for the last 4 months. And I am completely addicted to this. I have a great facility that I go to here, so it's affordable. But they also do have the infrared sauna wraps that you can get now. Just make sure that it is a low EMF system that you have. Now, every time before I would do the infrared sauna, I would take niacin. So I worked my way up to 500 milligrams of niacin, which essentially makes you sweat more, vasodilates. If you've ever heard of a niacin flush, I mean, there are some intense niacin flushes that I experienced. But now that I know that they are completely fine, I actually don't mind the flush, and I kind of actually use that as a marker that it's working. Don't use that as a marker if it's working, because it is working. Other things that I would do is I did 5 sessions of hyperbaric oxygen chambers. So a hyperbaric oxygen chamber, it was a hard shell chamber where they get you to, I went to 2.3 atmospheric pressure. I sat in there for 90 minutes, and then it creates a hypoxic environment and a response that drives VEGF, so that growth factor for the brain. Really, really important. And they said that the people that were experiencing post-COVID symptoms that did the hyperbaric oxygen, they saw kind of a range from 3 to 5 sessions is what everyone took, and then they kind of felt better. So that's where I did 5 sessions. It can get expensive, and you just make sure you have to find a proper facility, because they're private. You can't do this through a hospital. Your insurance will not cover it. So figure like around $200 a session for that. Some other things that I added on were Normatec. So one is something for lymphatic. I did not go get lymphatic massages, but I would add that on to get a lymphatic massage. So I did Normatec. Whole body cryo, I would do a session 3 times a week, and that was to drive and kind of strengthen my vagus nerve. On days that I did not do the infrared sauna, I would do a clay bath. So either a clay bath or a hydrogen peroxide bath or an Epsom salt bath, but I would do a hot bath for around 30 minutes with my niacin on the days that I was not in the infrared sauna. So at least about 6 days a week, I was doing something to drive the sweating response to the toxicity, so I could detox. So that's something that I had done. Now, some other bonus stuff as we wrap up, and then hopefully this helps you guys, is I stopped caffeine. I'm very sensitive to caffeine, but I was even more sensitive to caffeine during this period, that if I was feeling somewhat connected in my brain, and if I took caffeine, it would just throw me off the edge, and then I would just be kind of uncontrolled. So I would stop the caffeine, very much limited alcohol, because if I was detoxing, I don't want my liver having to deal with anything else. So while taking the glutathione and the milk thistle and things like that, I was limiting my alcohol. Got 8 to 9 hours of sleep consistently, because I wanted to be able to repair and restore my body. I stopped gluten, and I don't eat a lot of cookies and things like that, but anything that was processed in that way, and then the gluten, carbs, pasta, anything like that, I cut out. And my diet was essentially a protein, so like a steak or something like that, and then just a vegetable. And it was, I looked at all of the vegetables that have high pesticides and those that have lower pesticides, and I essentially eliminated anything that has higher pesticides, even if you take organic. I was just trying to really, really screen that out. I actually looked at my makeup and switched all of my cosmetic products to be those that are known to have low toxicities. So anywhere else, I unplugged the internet router from my home every night, and I always keep my phone on airplane mode. I've always done that, but I've never unplugged the router. And I also do feel that after I did that I started feeling better as well. So at night I unplugged the router so that just my whole family is not exposed to those EMFs when we're sleeping. I was told to take out dairy, and I did for a little bit. And then when I added it back in, just because I like dairy so much, I actually had no response to it. I do more lactose-free dairy and things like that. But I didn't have a trigger from dairy. But think about that maybe you want to cut out dairy. And then a big one, oh my gosh, is I cut out peanuts. So peanuts and coffee, and actually other foods as well, can have mold on them. And I was having a ton of peanuts and peanut butter. I absolutely love peanut butter, but a lot of them can have mold. And because I was trying to just watch anything I could to take mold out of my body. That is something that I did as well. So that is the summary. I hope that this helps you guys in your post-COVID experience. And if you have any questions on what I experienced, or maybe what you're experiencing, or any of these supplements, I encourage you to just reach out. And again, I'm not an expert on this, but it is something that I want to share what I have gone through to encourage others to stay positive, to reach out to a functional medicine doctor, and to just stay positive in this experience, and to just spread the word that post-COVID brain fog is something, even if it is the straw that broke the camel's back. Thank you guys so much.